Work in a couple of labs there, and I've been doing some interesting stuff with virtual reality, AI, medicine. You can ask me questions about that at the end, but I'm just going to focus on the virtual reality aspect today. Okay. So what is the one thing that connects us all? Most would say our emotion. Some would say our behavioral tendencies. And I think few would say our knowledge. But I would argue that it's something different. I would argue that it's our health. Our biological and physiological need to survive on this planet. Now take a moment and imagine if that was taken away from you. If you grew up in a completely different part of the world, where your identity, who you are, was compromised, simply because you grew up in a developing country. A place where the idea of a sustainable healthcare system was just that, an idea. To us, it's our greatest nightmare, but to so many people around the world, it's a reality of the present. So this whole worldwide healthcare efficiency inspired me to take matters into my own hands, and that's why I decided to join Sick Kids. I do a lot of round-the-clock stuff, so I'm there from like 8 a.m. to like 11 p.m. at night. I work in a couple of labs, but one of my focuses now is combining the idea of virtual reality to enhance global health and healthcare worldwide. So recently, I connected with a patient, and she had a really rare cardiac genetic disorder. It's called pulmonary vein stenosis. And now I see a lot of these patients coming in and out of the hospital because I work on the research side, but I also interact with these patients on a daily basis. But for some reason, this patient in particular, she stood out to me. And I remember the other day, we were just talking about random, everyday teenage things, you know, things like boyfriends, basically every parent's worst nightmare, for those of you who probably know. But then the conversation started taking an interesting turn. She started telling me about how she wanted to do things like change the world and impact billions of people. A lot of the stuff that we practice in TKS and a lot of the stuff that I'm basically prepping for now. It's called like a unicorn person, training yourself to impact billions of people. So naturally I was really curious because this was a patient. She has a really rare genetic disorder that we can't even find a cure for. And here she was telling me that she was grateful, privileged even. So I asked her why. I asked her why she was so grateful. I asked her why she was so privileged. And she looked at me and she said, you know, Ria, I'm lucky enough to live in a country that puts our health as a first priority. I don't live in other countries worldwide that don't have resources to keep their citizens alive on a daily basis. And that, like, let's just say I was in complete shock. For this patient to be telling me that she was grateful after everything that she's gone through, after everything that she will go through, was absolutely crazy to me. Because she still wants to live for a cause greater than herself. She still wants to impact someone greater than herself. And she was absolutely right. A patient living on this side of the world has access to the world's leaders in technology, medicine, health. They can go to sleep knowing that there's someone tirelessly and relentlessly working to fight to find a cure for them. But there is another side to this, a side that most people don't tend to see when it comes to things like technology. A patient on the other half of the world doesn't have that same support system. They don't have someone who's tirelessly and relentlessly working to find a cure for them. They have someone who's just diagnosing them and that's it. They go and live the rest of their life or whatever's left of it. They don't have access to that innovation simply because they grew up in a completely different part of the world. And it's not even a situation that you can control. So this inspired me to do a little more research into the whole demand to supply ratio of doctors versus patients. This is the biggest problem. When we think about things like medical innovation and stuff, we don't normally hone down on the reason that so much of this innovation doesn't exist worldwide. And that's mainly due to the demand to supply ratio of so many doctors to patients worldwide. As the number of patients is increasing, the actual amount of doctors is decreasing. It's not enough to sustain the growing amount of patients, especially because there's so many problems that are taking place nowadays with things like genetic variants and environmental diseases and pollution and cancer and all these different types of things that are becoming more environmental and more exposed to so many people in these developing countries. According to a study done by the World Health Organization, over 45% of member states reported that they only had less than one doctor per 1,000 patients. Less than one doctor per 1,000 patients. Compare that to a country like Qatar, which is currently one of the world's most forward leaders when it comes to things like medical innovation, having an all-time high of 8 doctors per 1,000 patients. Doesn't seem like much, right? Until you compare it to so many different countries that don't even have one doctor per capita, that don't even have one doctor to sustain 1,000 patients. They their demand to supply ratios are increasing sustainably. And that means that something needs to change, because we all know that the number of patients is not going to decrease anytime soon. So we need to start thinking about how we're going to maximize our resources, maximize our efficiency of doctors worldwide. It's important to note, though, that having all these shortages, they don't only come with the lack of an ineffective healthcare system. I mean, having a lack of a sanitation system in so many different countries worldwide, it's not something that we can control on a daily basis. We can't go around and rid every single country's lack of an infrastructure or lack of a sanitation system. It's not something that we can control over the moment, especially because these are problems that have piled up over years and years and years of abusing our environments. But the part that we can control is not something that we're doing enough of. If you think about it, all the privilege in our world, all our resources, technology, they're being concentrated towards just one area. And that's the developed portion of the planet. That's the planet that we're living in. That's the 20% of the planet. The States, Canada, where we have all of this access to medical innovation. But if we want to continue to progress as a human race, we can't only involve 20% of our population in that change. We have to harness the brain power of 1,000 and thousands of patients in the world, 100% of our population. And that all starts with giving them a good idea of healthcare, giving them a good education of healthcare, giving them proper medical diagnosis and consultation. We have to start focusing on how we're going to delegate our innovation. Having that lack of experts, having that medical consultation catering to them, that's how we're going to solve a lot of these global health issues. That's the part that we can control. This is why today, just for the next few minutes, I want to inspire you into a new vision. One where we can use technologies like virtual reality to completely change the game when it comes to enhancing doctor-to-patient communication worldwide. So we can give so many patients suffering around the world a chance to healthcare, the right to healthcare that we take advantage of on a daily basis. This is a project that I've been working on with sick kids, and I'll go a little deeper into it. You know, we're lucky enough to be living in a time where the evolution of health is constantly growing, with new innovations coming out left and right faster than we can ever imagine. But developing countries can't do the same thing. When you look at their timeline, their evolution of healthcare, it's a constant. Nothing ever changing, growing, or developing, or innovating even, simply because they don't have the resources to be able to enact that change. Just by living in this part of the world, you automatically have an advantage, because you have access to all these different innovations, as I said before, all these different medical experts, an unlimited amount of hospital food, like literally an ambulance a phone call away, which dramatically increases your chances of survival versus if you were to have a disease, that same disease in a developing country. And that's why I'm so passionate about solving this problem. And that's why I'm so passionate about figuring out ways that we can delegate our innovation to our entire population, not just the parts that have that resources to be able to progress for the future. So this is where telemedicine comes in. Some of you may have heard of this, some of you may not, but there are advancements being made in a field called telemedicine. Think of it as a subset of the medical field, which is basically doctor-to-patient communication online. Now, this idea of telehealth was constructed for this exact same global health inefficiency, to provide so many doctors and patients worldwide a chance to connect over one central database, a chance to have that access to education, medical consultation. We have a lot of telemedicine specialists at Sick Kids. And I was talking to them just yesterday. I was having a group meeting, and we were just talking about the different ideas, figuring out industry problems with telemedicine. And we came to one conclusion. Now, a lot of telemedicine, it sounds like the perfect solution, right? Well, in 2016, it was reported that a couple researchers who wanted to investigate this new field of telemedicine decided to pose as patients and turned to 16 different telemedicine apps to diagnose their skin issues. The results? Some of the doctors misdiagnosed a condition for syphilis. Some of them prescribed unnecessary or the wrong medication. And a few of the doctors weren't even licensed to practice in the same state that telemedicine was in, or that the patients were living in. Crazy, right? And I'm just scratching the surface when it comes to problems with telemedicine. Even getting doctors to jump on board this idea is much easier said than done. And it takes a lot of convincing and time and patience. A lot of them don't want to be held to the liability in case something screws up or in case they provide a wrong consultation to a patient, simply because they don't have that visualization as if they would if a patient was sitting directly with them in a hospital. There's no substitute for that. And that's a little bit of the discussion that we were having at Sick Kids, how we're going to optimize this, how we're going to start thinking about how we're going to revolutionize telemedicine for our future. Nowadays, we have some really, really sick technology, like things like virtual reality unlocking amazing value when it comes to fields in medicine, innovation, so many of these different types of things. Probably though, one of the most promising elements that VR brings to the medical industry is the use of virtual reality and 3D models for surgeons to simulate surgery and plan operations with. The industry alone is expected to grow by almost $5.1 billion by the year 2025. A study done by UCLA School of Medicine proved this. Participants and students who use VR models to train for surgery had an increased efficiency of over 230%. 230%. And that's just in comparison to the normal methods of learning like class books or like textbooks or class lectures. But here's the catch. This doesn't exist in a 2D telemedical world. If patients want to communicate the complexity of their diseases through scans, a lot of telemedicine solutions enable them to communicate that data over an email platform. In an age where we're using biometrics for body language recognition or machine learning to predict sepsis, why are we still going back to the old ways of using technology? Why are we still using things like emails or FaceTimes to deploy medical data or communication with? It just doesn't make any sense to me. Telemedicine was really supposed to be the next big thing in healthcare, a way to completely revolutionize the way that doctors and patients communicate by having them connect over one centralized platform. I'm sure, as you know now, it didn't turn out that way. In fact, there's so much more to the story as to why telemedicine ended up being ineffective, and why we have to start thinking about how we're going to change that vision for our future, how we're going to change the technology that's built on it. I'm not saying this to shame our medical system or to say that we haven't made any progress. We have made a crap ton of progress that we can't even count right now. But it's not enough. We have to start thinking bigger and brighter. I'm saying this so we can hold it to a higher standard. You know, when we take a look at our timeline of medicine in the past, present, and future, a lot of what stands out are those changes. A lot of practices that we've used before in our past, they're just things like planning, simulating surgery, having these operations, just basic medical procedures. Now, we can completely revolutionize that with the power of virtual reality and technology. That variable that causes all these changes is that factor of technology. More specifically, harnessing the power of that technology towards breaking down the barriers of simple conservative medicine techniques. One of the reasons technologies like virtual reality and everything, it's so underdeveloped, even though it's such a fast-paced industry and it's such an integral part of our technology system, is because we only look at it at the context of things like gaming or basic medical procedures. But if we want a future surrounded around this technology, then we have to start thinking bigger and brighter, like I said. We're now at a point in time where we can completely reach into a new future, one where technologies like virtual reality can completely change the game when it comes to training the doctors of the future with using the technology of the present. But it's not enough. We can't just expect to train the doctors of the future and just leave it at that. We have to train these doctors to know what the problems are in our medical industry and global health and all these different types of things, and figure out a way to tackle them. Figure out a way to tackle them with the power of this technology, with the power of this innovation. This is where virtual hospitals come into the picture. So I was having this vision of the future the other day, right? How all these innovations, how so many of these really sick applications of technology, how they actually all came to be. And I realized that they never actually started out with being a vision of the future. They always started out with being an idea that was developed in the present. Virtual reality and virtual hospitals can exist in the exact same way. We all know that telemedicine still continues to be technologically limited. That's not the secret. What is that our scope of thinking about the possibilities is even more limited. All we need to harness this new future is just good ideas. Think about it like that. So here's my vision. What if we were able to use virtual reality instead of emails or FaceTimes to connect doctors and patients from all over the world? What if doctors sitting at sick kids or another hospital were to throw on a VR headset and view an entire hospital surgical simulation, or be able to immerse an entire hospital's patients and see their anatomical structure to actually give a proper medical diagnosis or consultation with? This is exactly what the power of virtual reality can do, and why we need to start thinking about how we're going to harness this for the future of global health. Virtual reality in medicine is no longer a question of when. It's a question of how we can deploy this technology towards 100% of our population. This is what virtual hospitals can do, and this is what I'm going to try to promote from now on. You know, it's no secret that our future is built on the intersection between technology. A lot of what we practice in TKS is going from 10% to 10x bigger. How can we, if you're just thinking about your day the next day, right? That's it. You're just thinking about one day in advance. I'm thinking about 10 years in advance. What if we start thinking about 5, 10 years in advance about how our future is going to look like? We can go from thinking 10% to 10x bigger with just the power of virtual hospitals. What if doctors or patients can connect 7,000 miles away from each other just by throwing on a VR headset and having that communication over a virtual reality platform, giving an accurate, sufficient medical diagnosis to so many patients around the world that don't have access to the same right as healthcare that we do? And technology is advancing at such a rapid pace that so many doctors and surgeons are now turning to things like mixed reality to interact with 3D X-rays, thanks to companies like Microsoft and their HoloLens headsets. Now, like I said, just take a moment and imagine if a doctor sitting at Sick Kids or another hospital were to throw on a VR headset and view an inpatient 7,000 miles away, where they were able to diagnose them and properly give a medical diagnosis to them and consultation, all these different types of things, just by viewing their anatomical structure. If another country is revolutionizing medicine, we no longer have to sit from the sidelines and watch. We can be part of that change. Better yet, we can immerse ourselves into that change and actually figure out a way to log in or tune in to see all these different groundbreaking innovations and diseases that these hospitals are trying to solve. Just with the power of virtual reality and with the power of virtual hospitals, we can enhance medical training worldwide. So this is a model that I built a little earlier. I presented this at a software development conference, IBM. It's called Evoke this past week. And this is a little more on the technical side, but basically this is a vision of what I predict a virtual hospital to look like. So having these 3D stimulated organs, and basically a demo of what I believe to be a vision of the future when it comes to things like virtual hospitals. Even having 3D MRIs or 3D analysis, what if you can incorporate those scans and stuff into a virtual hospital? So doctors all over the world can see the diseases and everything that you're trying to solve. This is amazing stuff. We can lead a whole new generation of medical professionals, whether it just be a surgeon who's, prepping for an operation the next day, or a student who's fresh out of medical school that really gets scared when they actually see what surgery is like. We can use this for so many different types of things, and this is just the beginning of what we can do. So in our cardiac lab at Sick Kids, I work in 2 labs. One of them is a cardiac genomics lab, and the other one of them is an AI genomics lab. In the cardiac lab, a lot of what we focus on is measuring the progression of cardiac diseases using things like 3D imaging. I'm sure you guys have probably known about 3D imaging for a long time now. It's definitely not something new. And a lot of this allows us to keep track of diagnosis and having that early intervention with patients and being able to understand the anatomy of their diseases and help them early on before it gets too late. But one of the main objectives of our study that we're figuring out right now is how to have a central database for communicating disease information, all these different types of things. So I work with the research database at Sick Kids, and when I log onto it, I can see all these different countries and all their different types of medical data from their patients and everything. But in an age where our bodies are in 3D and we're using so many different 3D forms of technology, why are we still relying on things like 2D scans or 2D medical databases? What if virtual reality can provide that same database, except having all that information communicated over a 3D platform? This is exactly what virtual hospitals propose. Instead of simply having a way to log on for patient information just to see it on a 2D database, we can literally translate that information over a 3D hospital. So this is another way that I was able to create a virtual reality simulation using the Google Autodesk and Poly software, their virtual reality software. And basically, I was figuring out a way to create a virtual reality simulation that would be in the virtual hospital. Now, we all know that virtual reality for SLAM, it detects objects in real time and basically translates that to a virtual world. This is exactly what the power of virtual hospitals does, except having better 3D medical visualization and having that factor of communicating with patients and being able to train a whole new generation of medical professionals. Yeah, this is just a close-up of what I was able to do a little more. During a telemedicine session, a lot of times patient information is captured with things like sensors or scans or apps. Well, if we had a virtual hospital, the use of those sensors and stuff would not even be necessary. We could go from that. We could go from thinking 10% bigger to 10x bigger, where doctors would be able to view patients in real time and actually monitor them for disease diagnosis and all these different types of crazy things. Like I said, not only for medical consultation, but for also surgical training as well. We can give a chance to so many adults, children, so many families worldwide that don't have access to the same resources that we do to change for the future rather than always being left behind in the present. A chance to feel like they have a support network from the greatest hospitals in the world, from the greatest names and institutions and experts in the world. There's nothing that's more valuable than that. That's the power of what virtual reality can do. It can immerse ourselves in an entirely different world where we no longer feel alone anymore, we can have connection with so many different people, from just regular, average, everyday people to having medical experts over this centralized platform. But of course, none of this can be done without having proper infrastructure and partnerships. I'm not naive enough to say that we're going to go ahead and launch this whole big thing in a random clinic in a developing country. That's not the way it's going to work. At Sick Kids, what I'm focusing on right now is a little bit of international travel and obtaining a fellowship where I can actually go across the world and work with these developing countries and stimulate these different types of partnerships and infrastructure to bring this virtual reality idea about. So we have this program at Sick Kids, you can search it up, it's called the Kusamala program, where basically doctors in Canada go to doctors in Malawi. And I was talking with my good friend, he's a nutritionist at Sick Kids, and he's one of the leads for this whole Malawi program. And he looked at me and he said, Ria, it's really hard for doctors to physically and financially go halfway across the world and back. Obviously financially hard on the hospital, and also physically hard on the doctors because they have so many patients in this part of the world. They have responsibilities and all these different types of things. So while I was talking about this virtual reality idea, he said, it's not only amazing for things like medical training or surgical training, but it's also amazing so we can make a one-time investment. We can fund this opportunity to be a chance to grow for our future instead of constantly, sending doctors and patients worldwide to check up on them. It's just not done. It's not an efficient way to do so. And that's why we're trying to bring virtual reality in this program and try to incorporate it. I'm sure one thing that we can say in our future is that the things that did not seem possible 50 years ago are now our new reality. But it's not enough to end the discussion there. We have to figure out a way to create a dynamic shift in the process that doesn't only allow us to focus on tomorrow's success, but figures out how we can disrupt the healthcare system today. Focus on solving for the basic right of healthcare before we move so far into futuristic innovation that we forget what keeps it alive. It's the citizens of our planet. Not every story has a happy ending though, and the reason I kept this black slide is because I want to pay a little tribute to my patient, the patient that I mentioned in the beginning, the one who kind of got me started on this whole global health spiel. She passed away recently, and she passed away before she could have the chance to change the world. But she passed away knowing that there was a better future that lied ahead for us, that collectively, if we work together, we could focus on creating a better tomorrow for so many people worldwide. We could help people in the same way that she wanted to. And I don't get to let that talent die in vain. And I sure as hell don't get to spend the rest of what would have been her life not continuing her message, not working to solve for the thriving of the future for the entire world. The last thing that she said to me before she went to surgery, she looked at me and she said, Ria, I can't live in a world where there's so many people that have trouble surviving to the next day, and in this part of the world, we're always constantly thriving for the future. We have to figure out a way to create a dynamic shift in the process, like I said. Figure out a way to cater our resources to present for the future of our humanity. It's not only for them, it's also so we can progress as a human race together. So we can focus on, impacting billion-dollar problems. So we can focus on building unicorn people and unicorn companies. And that all starts with the fundamentals of our health. That all starts with the fundamentals of our healthcare. I'm an AI and genomic researcher, a lifelong learner, and a VR and AR developer. Most importantly, I'm a global health innovator, someone who's passionate about turning challenge into change, unconventional into conventional. And that's exactly what the power of VR will do, because we can't successfully build an annex for medical innovation if we don't focus on how we can disrupt the healthcare system today, how we can focus on solving for the healthcare system right now. Instead of only fixing the medicine of tomorrow, let's start by fixing the medicine of today. Thank you. So yeah, that's just my contact information. I have a website up. That's my Sick Kids email. Sometimes I check it, sometimes I